Good afternoon, everybody. I'm Jody Hanson. I'm Director of Public Affairs and Communication for Johnson County Government. I have with me today Dr. Sami Ariola, who is the Director of Johnson County Department of Health and Environment. We also have Elizabeth Holshoe, who is the Director of Epidemiology. And Brett, thank you for providing ASL interpretation. Thank you to those on Facebook who are watching today. And Dr. Ariola, let's get started, please, with an update on where we are this week. I know we canceled clinics today because of the weather. So maybe talk about what's planned for next week or the rest of the week.
Thank you, Jody. Good afternoon, everyone. Because of weather and the intermittent power outages, for the safety of our residents and of course the workers there, it was important to postpone the clinic today. The clinic that did not happen today will happen next week, Wednesday, February 24th. And so if you had an appointment there today, you show up not tomorrow, but next week, Wednesday. You show up at the same time that your appointment is today with your appointment notice and the required documentation. Again, if your appointment was canceled today, you are rescheduled for next week, Wednesday, February 24th at the same time in the same location. So we hope to see you then. For those that have an appointment tomorrow or Friday or Thursday and Friday, we are planning to be open. Please come at the scheduled time. We are asking you to consider your safety from the time that you walk out of your home to driving. There's snow on the ground. I think there's a forecast that there might be additional snowfall overnight. So safety first. We do have staff in place. We have processes in place to ensure your safety at the location. But again, as we have said a few times, consider your safety. If you do need to cancel, if it's not convenient for you to come, we cancel your appointment and we'll do our best to get you rescheduled as quickly as we can. But the clinics are on tomorrow. They're on Thursday as well as Friday. The clinic that's canceled today is rescheduled for next week, Wednesday. Just come. You do not need to book a new appointment or do anything. Just show up at the location at the time that you are scheduled to be on today. And Jody, I've got Elizabeth here. And one of the questions that we've been getting for the past few days is that our numbers are looking a lot better. There's no question that our residents have done so well. They have been wearing masks. They have been physically distancing. They have been committed to all the things that we have been asking of them for several months. Look, it's been about a year since we've been doing this. So fatigue is real in doing things that we don't typically do. The frustration of not being able to get together with family members during the holidays, those are real. However, even with the caution that Elizabeth will talk about very soon, I think we can see some of those fruits or products of our commitment to those tasks. Our numbers are down, and it's not just the number of cases that we're tracking. Is that some of the key indicators that we're looking at, like hospitalization? Again, remember the phrase "flatten the curve," which is part of our goal was to protect our hospital resources. Those numbers are trending down, as well as the number of deaths. So those are successes. We do know that there could be bumpy roads ahead, but we do want to make sure that we acknowledge that, and that hopefully that is an impetus to keep doing the right thing. And even as we vaccinate, we know that we have a long way to go, and we need to keep doing those things. But what a great job our residents have done. Elizabeth, you want to talk a little bit about this?
Yeah, thank you, Dr. Ariola. I'd absolutely like to echo his comments that I think that our community really understood, particularly in November and December when we saw our numbers spiking. There were warning bells from our hospital system saying that they were, getting to that point where things were critical. And our community rallied around. I know that if we look at our testing data leading into the holiday season, people were getting tested, people were doing what they needed to do to try and keep their family and friends safe. And we have seen that decline. And, you know, as Dr. Ariola said, we've also seen declines in hospitalizations and deaths. You know, a lot of the times that we look at the numbers, we also look at our testing data, because if we're getting less cases, but we're also testing less, it makes us question whether or not that's true. And we have really seen a pretty steep decline in the number of individuals in our community who are getting tested. However, I think that the decline in hospitalizations and deaths really do speak to that this is a true decline in COVID transmission in our community. But always the health department with the but here is that doesn't mean that it's time for us to ditch our masks and start partying and doing all the things that we desperately want to get back to doing. There are still concerning signs about the new variants. So we hear a lot about the variants throughout the world. Coronavirus, because of the way it replicates, causes these to pop up a lot. And when one of them becomes dominant and starts spreading at a higher rate, infecting more people per individuals who are infected. So if I'm infected, if I infect 6 people because of the new variant, as opposed to only 2, that's a big difference because that next person is going to go and infect 6 more. And these new variants that are becoming more prominent, both in the US and the world, are like that. They are more infectious. So we can see a spike back up in our cases. And because of the lag time, it sort of spreads silently until it hits a point where we start seeing it. So we all need to continue to do all the things that we're talking about. Wear your masks, keep your distance, try not to gather with people outside your household, stay home if you are not feeling well, and stay home if you have been in contact with somebody who's had coronavirus. All of these can help continue to keep our community safe and really have the outcomes that we're hoping for, which is getting kids back in school, keeping our healthcare system safe so that, you know, if you have a car accident or a stroke or a heart attack, that you can seek care and have a bed for you. And all of those are community-wide issues. And we all need to continue to really act as the community that we have been and do what we need to.
Yeah, and along the same line, you know, around November, December, we had this huge increase in the number of outbreaks in our long-term care facilities. At some point, I counted over 40 facilities with ongoing outbreak. I checked just before this session, we're down to 14 or 15, and one is about to drop off tomorrow. That's a huge development. It's not just because the level of community transmission has dropped, but also because of the vaccinations in that population. And all of those are good things. Now we do need the workers there to do better in terms of taking the vaccines. But do you want to also just, we're not quite at 10% yet, but we're increasing the rate of vaccination and breaking the cycle of transmission across the country. Do you want to say 1 or 2 things about that also, Elizabeth?
Yeah, absolutely. I think that, you know, part of the reason we are seeing our decline in deaths is because we know individuals in long-term care facilities, particularly when there's an outbreak, we do see a lot of deaths in those locations. And so I think that's been a really great benefit. You know, the vaccine really is a game changer, particularly for these really vulnerable populations like long-term care facility residents. But absolutely, we need to continue to stay vigilant. Community transmission, if it's high, it can still get back into these facilities. We know the vaccine is good, but it's not 100%. And so the more sort of introductions you have of a virus into a facility, the more likely it is that it'll start spreading throughout there. So, but I think that our partnership, you know, the pharmacies who have done the federal pharmacy program and immunizing our residents and our staff have been great. And it really has helped us see some effects from our hard work, not only in the last, you know, several months of trying to vaccinate, but in the last several years, or last year of us trying to contain this virus.
Yeah, and Jody, we wanted to emphasize those points. There's still a lot of work to do. It is the same reason why we chose to focus on 80 plus. It's the same reason why we're asking health systems to focus on the 65 plus. They are our most vulnerable population, and it's going to be more impactful when we're able to use targeted vaccinations to start with. Obviously, once we have enough, the need for that will be reduced to be able to decrease the risk of adverse consequences, to be able to decrease hospitalizations and death. Those are very important things. The second piece, which again, I'll ask Elizabeth to get into a little bit of detail, is our vaccination in our educators, K through 12, as well as our childcare. Those are also intentional. Again, that's the second population that we have focused on throughout the response. We wanted to keep our childcare centers open. We've been very clear that we want our schools open. We have devoted a lot of resources to our schools. And when we were having a ton of cases, we chose to prioritize case investigation and contact tracing in our schools so we can do our best to keep them open, because we understand it's not just better for children to learn, but also it's important for their social, emotional development and those things. There's a lot of ongoing activities working with Children Mercy in vaccination in that group, and I do want Elizabeth to talk about that.
Yeah, and I think really when we talk about immunizing teachers, if you remember back to November, for those of you who are parents of school-aged children, when our community transmission got really high, the big concern became the fact that they didn't have enough subs to fill the teachers' roles, right? Because the teachers were either infected or they were having to quarantine. And when we can get a large percentage of the teachers immunized, if they are exposed, they will be able to stay in school, because we don't believe they won't be getting sick, not nearly at the rate. And as long as they remain asymptomatic, continuing to wear their mask and all the things that they should be doing, they can stay in school. So that eliminates one of those concerns in terms of keeping our schools open. So 2 weeks ago, we were able to immunize about 3,500 public school staff members. This week, we'll be immunizing a little less than 2,500 of the public school staff members. And so for each of these weeks, we're just chipping away at this population, the same as we're doing with our over 65 and our over 80. We just have to keep going incrementally and immunize as many of them as we have vaccines available. And I'm very excited that not only has the partnership with Children's Mercy been such a success, the vaccine clinics are incredible, but we're also seeing a great amount of uptake among our school staff, which is excellent as well.
And lastly, just based on the responses that we're getting from people, if you are 65 or older, you do qualify to receive the vaccine. But we're just putting things in perspective. That category, we have over 95,000 of our residents there. We are choosing to focus on 80 plus, but even that group is over, there are over 20,000 of our residents that in that group. And so those vaccinations are ongoing, but because there's such a large group, 6,000 vaccines, 6,500 vaccines a week may appear to not be reaching you as quickly as you want. I know that you want us to be able to tell you when you will receive the vaccine. We're inching closer to that. We are opening up vaccinations for second doses from tomorrow through next week, Wednesday. And then we are, based on what we received this week, we're opening up vaccinations for 80 plus. Our health systems are opening up vaccinations for 65 plus. And I'll just reiterate what we have been saying, that every week that we are vaccinating 6,000 plus in that category is 6,000 fewer persons in that group. And so we are, while we are right now unable to tell you when you would, we will be able to do that in the next few weeks. Again, we're working through that list, and we continue to appreciate your patience.
It was a lot of good information, and it answered a lot of questions I think that I'm seeing there on Facebook. So thank you for sharing all that. I have written down a couple of questions that I'm going to give to both of you. So somebody just asked, they don't understand why somebody who is under 65, who has underlying health conditions, is not in phase 2. Why is that in phase 3? Why would that person be in phase 3? And I would ask you to talk about how is that decision made?
Yes, so I would first of all say that we have had similar questions in the past, and I don't disagree with your reasoning. I would say that the decision on what is in each phase was not made by us. It was made by the state, Kansas Department of Health and Environment. And I know that they had several criteria for that. And I know that there were several conversations around these things. As it is, phase two is a very, very, very big group. Across the state, about 1/3 of our population fall into that group. And so at some point, it becomes too large to manage. You have to take what may not be necessarily quantitative decisions, but rather qualitative, just based on the fact that you need to spread things out. Now, I'm not sure that that's the reason, but I know that if you take the 16 to 64 group with underlying conditions and it's in phase two, we may never get out of phase two because that group is already so large. I estimate sometimes we think that could be as few as 110 or as 100,000, but could be as many as 130, 140. That's a very large group. So I don't disagree that persons with underlying conditions should be up there. I do think that as we get more vaccines, as they become more available, as we get more vaccines to our health systems, as vaccines become more available through the federal retail pharmacy program to our pharmacies, as we get more and we are able to give out more at our clinics, I think this issue of phases become less and less important because we want you to get the vaccine, you want the vaccine. The only limiting factor is the supply. And I think as we break that supply obstacle, I think we can move through those phases pretty quickly. I think the resources are there across the county. I am convinced that there's a lot of capacity to dispense a lot more than we currently have. And again, we continue to make the statement that our goal is to make this available through multiple avenues so that you can go and get it like you would your flu shot. Go to a pharmacy and get it. Go to your primary care physician and get it. That is our goal. And I think the phases become less important as we vaccinate more people and we get more vaccines into the country.
You know, I'm watching our Facebook feed of people who are commenting and asking questions while they watch, and I'm seeing a lot of conversation about what are the options, where can I get it, specifically what lists can I get on, and people are sharing links. So I guess in addition to taking our interest survey, if you are eligible for phase two, what are some other places people can be looking as far as identifying themselves and saying, I'm interested for this list?
Right. So first of all, if you have completed a online vaccine interest survey, that's all you need to do. We are working through our list. I had several conversations with Elizabeth and the team earlier today. And as we are opening up clinics next week, we're working down the list. Now, we also know that all of our health systems are giving out shots. The only, again, limitation is supply. I think yesterday I did talk about St. Luke's, Menora, Overland Park region. They are indicating that they need more vaccine and they want to do more than they have been doing. And so Advent Health, Olathe Health, and KU Med, they have much bigger capacity than we're able to give them. And so, so those are some of the sources. If you live in one of our independent living, then you can add Hy-Vee and Urban Pharmacy to your list. If you, I think there are about 4 or 5 pharmacies that are already receiving vaccines through the Federal Retail Pharmacy Partnership, and Elizabeth can provide a more accurate number. They are coming in small amounts, but they're coming. And so with some of our health systems, if you are a patient of theirs, they will reach out to you. But many of them are now creating options for you to also indicate to them, even when you are not their clients, that you want to receive the vaccine. So if you have that opportunity, even when you've completed hours, go ahead and do that. There's no harm in that. Now, you don't need to complete hours multiple times. We have people that are doing that several times. It does not increase your chances of being called. We're just walking down the list. And so all of those, again, are the options that are currently available. And as more vaccines become available, there will be even more options for you to be able to receive the vaccine.
Yeah, and I can chime in a little bit about the pharmacy retail program, which is separate from the pharmacy partner per ship program. So the retail program is going to be our pharmacies that are obtaining vaccines straight from the federal government. So it does not come out of Johnson County's allocation that we get every week. The primary pharmacies that we're aware of are Ball's Foods pharmacies. And so those are going to be some of the Price Choppers and Hen Houses. And I know that they have a website up where you can see if there are any available appointments. I know Walmart's as well. There was an article in the Star about a Johnson County resident who was able to, I believe, go to Independence, Missouri to a Walmart and found an open appointment. So continue to check those. They are getting very limited supplies, which as are we, but keep checking back, bookmark the page and keep refreshing, and maybe you'll get lucky and find one of those open spots, and you'll be able to get it sooner than you could through the Department of Health and Environment or your healthcare system.
We had a little bit of a conversation and a couple questions about today's clinic that had to be canceled and those doses that you plan to administer at that clinic. Any concerns? I mean, people, I think we're asking, did you have to thaw any doses out that now you can't use? Any concerns there about what you had planned and what you didn't get to use today?
No, we canceled. We made the decision to cancel yesterday. So vaccines were in the freezer. We did not take them out. So we don't have that problem at all.
Okay, great. We had a question about reactions to the vaccination. So whether it's the first dose or the second dose, what kinds of reactions are you seeing or hearing about when people get that vaccine?
So the most common reactions are obviously some pain at the point of injection due to inflammation mostly, or but also mild fever. But here's the deal. I think I was speaking to a group about the second dose. One thing to keep in mind is when I took my second shot, I was fine at the first few hours. I got home, took a shower, went to bed, slept off about 2 hours. I just had some pretty strong chills and then, you know, took another shower, slept off, woke up 2 hours after that. I was good. That was it. I knew Elizabeth had some, and she would talk about that, but that's really the vaccine doing what it's supposed to do. So our bodies react to foreign materials, whether it's biological or chemical, in ways that are designed to produce immune response. Try not to get overly technical. Sometimes releasing certain chemicals in the body designed to fight this, what we call insult or xenobiotics, which really stands for foreign materials. And so the way that the vaccines are designed is there is a part of the genetic composition that is that the mRNA vaccine brings, and your body recognizes that and thinks it's the virus, or this is something that I don't really like and I need to respond to that. So it starts deploying some of these cytokines, and then the T cells, B cells kicks into function and produces eventually what we call neutralizing antibodies. The goal is to protect you and ensure that the body responds by neutralizing these foreign materials. So the second dose, your body has seen this one time. It's like, okay, because there's also that memory part of it, which is I've seen this before. And so once your body sees that again, the response is stronger. It's no longer novel to your system. It's no longer new. And so that's why sometimes the second dose, you tend to have some stronger reactions there. But if you really think about it, that's your body doing precisely what it needs to do. That's what your body is going to do if it becomes infected with the real virus. Again, there's a lot of misinformation there. The vaccine is not introducing the virus to you at all. It's a part of the code that they're able to sequence and put into certain carriers to introduce into your system to trick your body into thinking that it is the virus. And the body reacts the same way as it would if you were infected by the virus. Those are the two vaccines in the market. The new one that's coming in is using a different mechanism, but the same thing. It's being carried through what we call adenovirus. And those are things that we are typically exposed to anyway. So that there's no harm to that. But your question was about the symptoms. Our bodies are programmed to really find a way to respond to foreign materials in a way to protect you. And that's what the body is doing here.
Yeah, and if I can just jump on top of that, we hear about allergic reactions, right? And those are going to be things where you need maybe an epinephrine shot. Those are really rare. We don't see those very often. That is when your body is reacting pretty immediately within usually half an hour, 15 minutes to something in the vaccine that your body just doesn't like. Those are very rare. What Dr. Ariola is speaking about is that immune response that comes from the vaccine, and that is what we want to see. So you do have a lot of people with these vaccines do have this immune response. Maybe some people have it on that first dose, some soreness, some fatigue, maybe some muscle aches or body aches. And then definitely with that second dose, as he said, because your body's already seen it once. When it sees it again, it ramps up that immune response so that your body is prepared for when it actually sees COVID-19. If you get exposed to it, your body will already know what to do. And so those immune responses that he's talking about, which quite frankly, some people can experience pretty severe ones after the second dose, that's completely natural and anticipated. It means that your body is reacting the way it needs to. And I can assure you, though, that whatever side effects, whatever the immune response comes from that second dose is probably going to be much better than having COVID-19 through an actual infection. It's only going to last a day, maybe two at the most, and then you're going to start feeling better. Whereas COVID-19 can take you down for a week, 10 days. And we know that there are individuals who have what we call long hauler syndrome. So they continue to have symptoms long after. So even though those immune response side effects are completely unpleasant, and I'll be the first to say that because I experienced some, that's so much better than what you would get with a COVID-19 infection. So please do not let that be a deterrent for you to actually receive the vaccine.
And there was some fresh statistics that came out. Obviously, all of these reactions are being tracked across the country. Now that we have vaccinated millions of people and tracking the data, those allergic reactions are very, very few. I think the numbers I saw yesterday were 60 something for Moderna out of millions, and even fewer for Pfizer. So those are very rare. The key thing is you will get, or you might get, some symptoms similar to what you get from a flu shot from that, but those, like Elizabeth said, very mild compared to the alternative of getting COVID-19.
So we have a question from somebody that was wondering, what if they already had COVID and they're still recovering from the infection? What is the recommendation for when they should or should not get their vaccine? And also, is it different if you're a healthcare worker? Does that change the answer?
So I'll start. So so first of all, if you have COVID, we want you to stay in isolation for the recommended period. Okay. So don't come to the clinic looking to get the shot, so you don't infect other people. If you are in that situation, cancel your appointment. We'll reschedule you. So after your exposure to COVID, the same immune response, albeit at different levels, occur. Your body will produce antibodies in response to that. So we operate under the assumption that could last for about 3 months. And so there's been recommendations out there that you might want to wait a little bit, not because you can't take it, but because you can allow other people to take it because you have some natural immunity. Other than that, there is no reason why you can't be vaccinated because you have COVID. Now, I don't remember the second part of your question, but Elizabeth, if you
Well,
remember, you can.
If you're a healthcare worker, is there any kind of a difference in the recommendation there?
Not really. I think healthcare workers, they deal with infection control a lot better on a consistent basis than the rest of us. But again, you do have some immunity after initial exposure. The degree may be different. And so if you want to wait for a few months, a few weeks to allow others to get the vaccine, that's okay. But there's no other contraindication or anything that I'm aware of related to not being able to take the vaccine after infection.
Okay, I think we have time for one more question. So we've got a question. If somebody leaves Johnson County and is able to get a vaccine, maybe at a Walmart over on the Missouri side, can they get their second dose locally in Johnson County? Do they have to get their second dose where they got their first dose?
Well, so I think they would just be giving Elizabeth and her team a lot of headaches. So we would rather you take your second shot where you get your first shot. Having said that, there are cases that will not be as important as we get more vaccines. Some people got their first shot when they're outside the county or outside the state, really, and they took advantage of it, and it's not practical for them to go back. And so that's a consideration that we take. But we're not really encouraging people to go get a shot from outside the county and come here, just because we have a lot of people that we need to vaccinate. And what comes to us, the second dose is we get an equivalent amount to the first dose that we receive. So that's creating, in some way, theoretically at least, some imbalance, because we will be sent only a second doses for the same first dose that we get. So if you go to somewhere else and you come to us, it can be very disruptive. But I also know that data and all the other ones Elizabeth has probably will have some, would rather that not happen, but we know that that will happen to a certain extent.
So there could be some exceptions. What people probably should do if they can is to get the second dose where they got the first dose, but if an exception needs to be made.
Yeah, that is true. And this, again, will become not as important once the vaccine become widely available and people can simply just get the vaccine wherever they can. So.
Well, before we wrap up, I just wanted to see Elizabeth or Dr. Ariola, if either of you has anything to say to wrap up or make some closing remarks.
For me, it's tomorrow. The weather is better. It's expected to be better than today in terms of temperature, but there's still snow. We expect some snow overnight. Safety first. If you don't feel safe, stay at home. Cancel your appointment. We'll try our best to reschedule you. If you can come about 10 minutes, not earlier than 10 minutes before your appointment time. These are really high throughput vaccination clinics that are really, we expect they are planned for a certain number of persons every 30 minutes. So even an additional 5-10 people can be very disruptive, not just to the 30 minutes when that happens, but for the rest of the because every 30 minutes when we are having sometimes up to 200 people come in, if you disrupt the 9:30 flow, that will have an impact for all of the sections after that. So again, if your appointment was for today, you don't come tomorrow, come next week, Wednesday. Only those with original appointments for tomorrow should come tomorrow, and don't come earlier than 10 minutes before your appointment time.
And probably dress warmly and know that there'll be warming buses and there'll be shuttles in the parking lot to get you inside and warm just as fast as.
Yeah, but it will be cold. So even though we have those resources there, we have vehicles that would drive around and pick you up closer to your car. We have warm buses and all of those, but it is cold. And so dress warmly. And I remind people, it's a mass vaccination clinic. That means there will be lines. What we try to do is keep those lines inside the building because of the weather. Now, if there's any disruption to that, You could have occasional lines outside. Because of the age of the population that we are dealing with, we try to not make that happen and make sure the flow is going on. And that's why we're asking people not to show up. But dress appropriately. That's why we have warm buses there. So if we need to have people stay in the warm buses, that will do that. But cannot overemphasize the need to stay home if you don't feel safe. Stay home if you don't have an appointment. Come closer to the time that you have. All of those are very important to the flow of the clinic.
Great, thank you. And Elizabeth, any final remarks?
I will say I was at the child care licensing clinic and the private parochial school clinic this weekend and ran into a couple of individuals who had received the shingles vaccine or another vaccine within the last 2 weeks. And that is something that means that you can't quite get the vaccine. And so there was some frustration there. So definitely consider, if you've just received a vaccine, that you're going to have to wait 2 weeks in order to receive the COVID-19 vaccine. And also going back to, for individuals who had COVID, while that does not preclude you from getting a vaccine, if you did receive a monoclonal antibody, if you received antibody treatment, so an injection of antibodies at the hospital because of your illness, that will actually make you hold off on getting the vaccine. So there are a couple of nuances there. If you have any questions, definitely reach out to your doctor and they can certainly help you figure out if you should get it right now or if you need to wait.
Great. Thank you so much, Elizabeth. And thank you, Dr. Ariola. Great information today. Thanks for those watching on Facebook and asking the questions. We will continue to answer them for you and just appreciate your engagement and your interest on this topic. So thanks so much and have a great rest of your day.
Thank you.